Hi. Sorry about the background noise. Obviously, there's always stuff going on, it feels like, whenever I try to record. Um, but yeah, I am not good at phrasing things. I'm a very socially awkward person, so I figured it might be easier to kind of make a video instead of telling people directly, just because I feel like if I can make a script, it might be a little less overwhelming. I'll try to answer any questions. But yeah, uh, content warning. If if mental health topics pretty much bother you, if you are sensitive to that kind of thing, or like physical health stuff, you should probably just skip this video and maybe unsubscribe if you are subscribed, because I talk about that kind of a lot. Um, but yeah, keep yourself safe. But yeah, I first want to go over kind of the terminology. Sorry if you hear background noise. My kitten is currently squeaking. She doesn't meow, she squeaks. But anyway, yeah, I kind of should probably start before this gets long. Many people assume that sex and gender are referring to the same thing, um, but they are different. Sex is referring to what you are biologically. You could be male, female, or intersex. Intersex just means that you have qualities that don't really put you into one category. Like, you could have the chromosomes of one sex, but on the outside look completely different. It's a huge spectrum. I don't know too much about it, but I'm sure you could find plenty of information. I don't feel like I'm one to talk on it. I don't know too much about it. But anyway, gender is referring to how you identify. There's man, woman, those are kind of the classic, and you're usually expected to be put into one of those categories. But there's also non-binary, which means that you don't really fit into that gender binary. You don't feel comfortable for whatever reason, and you don't identify with it. Most non-binary people use they them pronouns, but some are still comfortable with he or she. And there's also gender fluid. Gender fluid just means that you just don't really fit completely into any category, is the best way I could describe it. There's other terms. There's genderqueer, for example, but a lot of them can be boiled down to being very similar to what I just said. Like, demi-boy can refer to someone who identifies as a boy but not completely, like sort of in the middle between non-binary and male, if that makes sense. And for most people, their gender and sex do line up. They're born they're born a girl, and they identify as a girl and live their life as a girl, and they're fine. And they don't really think about it, they don't really question it, they just exist. But for some individuals, they don't line up, and that can be really hard, which leads me into my next topic, which is dysphoria. Gender dysphoria is basically just a feeling of discomfort and disconnect with one's gender. There's 3 types of dysphoria, and not every trans person is going to experience every type. Social dysphoria can best be described as dysphoria regarding social situations, such as being referred to in social situations or viewed as a gender you don't identify with, such as a trans woman being called sir. Someone who struggles with this might avoid going outside and interacting with people because it makes them uncomfortable, and they're so anxious about being misgendered they don't want to risk it. Body dysphoria is basically feeling a disconnect and discomfort regarding your sex not lining up with your gender. For example, a trans man might seek out things like top surgery or bottom surgery or use a binder or packer and may do HRT. Everyone's experience is different. Someone could experience chest dysphoria, but not bottom dysphoria. It's very individual to the person. Lastly, mind dysphoria. So feeling a disconnect and discomfort regarding feelings typically experienced by the gender you identify as. It's often described as a sense of almost being unreal, like you're piloting a body that's not yours. A good example of this is someone who menstruates and doesn't identify as a female. They might feel a lot of dysphoria regarding the fact that they're cramping and can physically feel it, that they're more emotional than usual. It can also be triggered by using someone's dead name, which is a name that they were given originally but no longer go by, or using their wrong pronouns. It can also be described as almost like a state of an imposter syndrome, but everyone's experience is different. Typically, dysphoria is treated with gender-affirming care, which is medical intervention basically to help someone with dysphoria feel more connected with their body. So think hormone therapy, voice training, sometimes surgery. It's individual to the person. Some people want certain things, some people don't. It really varies. Therapy is also a necessity, and very rarely can you actually even get medical intervention without getting a proper diagnosis of dysphoria. So if you want top surgery, for example, unless you go private, you probably won't qualify unless you have a diagnosis previously and several letters saying that this is something you really want and that you need it. A huge misconception is that it's being given away. You hear it in the news sometimes. It's not. It's actually really hard to get unless you're like really rich, and I don't think nowadays the average person has money to simply, fly to Thailand and get work done. A lot of places are actually banning gender-affirming care, which basically leaves those suffering with dysphoria to just suffer and live with it, live in a constant state of discomfort and unease, and that raises the suicide rate of trans individuals and people who experience dysphoria. Things like eating disorders are really common in people who struggle with dysphoria, alongside things like substance abuse and self-harm, which is why it's so important that people have the option if it's something that they need. Gender-affirming care is actually primarily done on cis people. Think a woman getting a boob job, basically, getting breast implants to feel more feminine. It's not that she isn't feminine, she's assigned female at birth, she identifies as a female, but wants to change certain aspects. And I believe as long as it's a consenting adult, it should be done safely rather than underground, because if it gets banned, more and more people are going to go underground for things like hormone replacement therapy and treatment, and that's not regulated by a doctor, which can obviously cause a lot of issues if the surgery is done wrong or they're given the wrong dose of hormones. There's also the controversy regarding puberty blockers, which actually have very little risk in the long term. The main risk is that it stunts your growth a little bit in most cases, but puberty blockers have been used primarily on just cis children. for things like early puberty to hit a pause on it until they're at an age where it's more appropriate, because it's really unfair to expect, a 4-year-old, for example, to be dealing with menstruation. It's very unethical and unfair and can be really traumatizing for a kid. So in situations like that, especially, a lot of people need it. Puberty blockers, you can stop them anytime, and you will continue developing as you would have normally. But anyway, I'm gonna move on to kind of my experience. Growing up, I've always liked traditionally feminine things. Like, I was really into, Monster High and Polly Pocket and Littlest Pet Shop, all that kind of stuff growing up. And I still do like some feminine things. And I think I kind of felt embarrassed about it, because people who are assigned female at birth and are under the trans umbrella are kind of expected to only like masculine things basically from the moment they popped out of the womb. My kind of body issues didn't really even begin until puberty. Some people experience dysphoria from a really young age, basically, since they're born. For some people, they realize during puberty, because that's when, your body changes a lot, and dysphoria and body changes don't go well usually. Feminine traits such as my chest and hips were most upsetting. Before puberty, I was kind of excited about it actually, because it's like, oh, you're becoming an adult, and my reaction was kind of just like, oh, cool, I'm gonna be treated like a grown-up and all that. But when it came to actually experiencing it was bad. But I felt like it was something I had to like, because it was something I looked forward to. One of my early signs, which I didn't realize until much later, was that I used to pull on my chest when it started developing. It just made me uncomfortable. I would just do it without even realizing a lot of the time. It felt more like a tumor or something rather than a part of me, if that makes sense. Like just a weird blob stuck on me. A weird little blob, and it was uncomfortable. But I kind of assumed everyone felt like that and that I would just get used to it. I actually got teased a little bit in school for having a smaller chest, and I felt kind of embarrassed about it. I didn't like people pointing out my chest, so I actually began stuffing my bra in kind of an attempt to make it look average so people wouldn't point it out as much. Periods were awkward. I started my period around, I think, 10 or 11. And in the beginning, my periods weren't bad. I wouldn't really have any side effects, so it was kind of like I could just put on a pad and forget about it and pretend it doesn't exist. And I thought that was how it was going to be forever, but no. Around 13, I began actually experiencing cramping, which made it a lot worse, because it's constantly getting a reminder that, hey, you're bleeding. And things like pain medication and switching over to tampons and all that, it helped. Not completely, but it did help a lot, just to make things more manageable. And I know probably no one actually likes having a period, regardless of gender. The first time you get it, sometimes you're like, oh, cool. And then you realize it's gonna happen, every month for years. And you're just like, okay, ready to hit the back button. I don't like this anymore. Get rid of it. But, yeah. And I would also experience this weird kind of depression. Suicidal ideations, I guess, would be their technical term. during my period, and yeah, I just felt like crap. And I wanted it to stop. I didn't like feeling like that. So even though I didn't bring up that aspect, I did bring up that it was making me feel very uncomfortable and that I wanted to be on like hormone blockers or something that would stop it, because I was like, okay, my body is making me upset. I want to hit pause and not have to deal with it. And maybe in the future, I will be more equipped. But I was told, no, everyone hates their body at your age. You'll get used to it and love being a woman. So I just kind of kept telling myself that. And around that time, my eating issues began. And I mean, a huge reason for things like my anorexia and bulimia were things like dealing with grief, depression, anxiety. Anxiety was a huge one. But part of it was knowing that if I got myself smaller, I wouldn't look as feminine. And I mean, I was kind of embarrassed a little bit because I was smaller than most people my age and often got mistaken for being a lot younger than I actually was. And that was a little irritating. But at the same time, the idea of gaining weight and maturing like a female should, it felt disgusting. So yeah, that was kind of one of my coping mechanisms. I would always hope that it would just stop my period one day, but it never did. And I wouldn't have actually mind gaining weight. I still wouldn't, if I knew I would gain it differently. On places like my waist, for example, and make my hips less noticeable. Or like, I don't know, just kind of proportion my body out differently. I don't really know how I would describe it. I did ask for birth control because I heard that could stop periods. And, I wanted it gone and figured, starting that might make me feel better. And I wasn't allowed to be on birth controls until I was like 16-ish. And sadly, it did not help. It actually made things worse. I bled for like 6 weeks straight. It was awful. My body did not like it. So I ended up stopping the birth control because it wasn't helping. It was making me feel like 10 times worse. At like 17, my eating issues went really bad. I lost a lot of weight, and I mean, I was already underweight for the majority of my teenage years because of my eating issues, but it just got worse. And yeah, I was sent to a hospital, and then I was sent to the psych ward in the hospital, and they said, basically, oh, we'll help you. We have a gender clinic here. We can help you if you gain weight and get healthy. And I was like, okay. And I used that as motivation to gain a bunch of weight. And then they pretty much said like, oh, I mean, you're medically stable now. And, you look healthy. So, I guess your dysphoria is gone. Yeah, you don't need treatment anymore. And then they sent me off to an eating disorder clinic for the other section of my recovery thing. And there were several trans people there who were in similar situations because, eating issues and gender stuff do sometimes link. Outpatient was a lot better. I was only in the children's outpatient for a short time because I turned 18, so they transferred me to the adult one, which I preferred. And once I was done with outpatient, I was allowed to talk to my therapist again because they were weird and didn't like the idea of me having a one-on-one therapy with my therapist. but they only gave me like 10-minute sessions there. Logic. And it was really awkward to talk about. I also opened up to my doctor a little bit about it, and both my doctor and therapist, they suggested more like reversible things at first to see what I like, experiment with things a little bit, and it helped. I didn't really like telling people about it. I felt kind of embarrassed. I only really told a few people, but, trying out different names and different pronouns and stuff, and trying binding and all that really helped. I found, what works for me and all that. I also started dating someone who is on the gender spectrum, and I do think that helped a lot with my confidence. Made me feel less weird about it, if that makes sense. It was just nice to have someone to talk to about it, and she also introduced me to some of her friends who had similar kind of situations, and that was really helpful. Sadly, like 2 years ago-ish, my brother sadly passed away, and just because of all the crap I was feeling, I ended up losing weight, and that wasn't good, and was told a couple months ago that pretty much, hey, you need to gain weight, or else you're getting kicked out. And I don't want to be homeless. That's not ideal. That's not a good situation. And I mean, I was told that for the gender affirming care I wanted, I would have to gain weight anyway, so I'm starting that now, so hopefully it works out. I have an appointment later this month regarding all that, and I'm excited. I'm very excited. It's kind of scary, but exciting. It's been something I've been wanting for years, and it's been a huge motivator to get healthier and be at a normal weight finally. I'll be probably making a part 2 regarding things like transition goals and everything, kind of my plan with that. How I would describe my kind of gender identity, I don't really know the best term for how I'm feeling. Probably somewhere under the non-binary or gender fluid spectrum. I just exist, I guess. I exist and want to safely be able to modify my body to feel more like how I feel on the inside, and I've been trying to not really put too big of a label on it. I usually just go with gender fluid or non-binary. I'm fine either way. I don't really care. You can use any pronouns. I don't love she or her, but I look feminine. I dress kind of feminine, so I feel like it's just gonna happen no matter what I do. So I vibe. He, him are pretty great. They, them. That's pretty snazzy. I just kind of vibe with whatever. And yeah. You can't misgender me. So take that, transphobes. I just exist. But yeah, anyway, if you have any questions, feel free to comment. No questions are bad questions. Apologies once again for the awkwardness. I was going to do a speed paint in the background, but art block hurt my brain. Cool thing happened recently. So to start HRT, you have to get a blood test, and I had to get like my hormones tested and stuff too. And it turns out my testosterone levels are actually on the higher side for a female. And I thought that was pretty cool. I was like, oh, well, that's really affirming. It made me feel better. I have been eating like insane amount of like peanut butter and stuff in an attempt to kind of keep my weight high, and things like peanut butter are supposed to increase testosterone, so like hopefully that did something. I don't know if it actually did anything, but you know, I'm just kind of a little guy. Anyway, if you want to friend me on Animal Jam, go for it. My username is literally on the screen if that's something you play. I don't really play it too much anymore. I kind of just play it on occasion, usually for the mini games. I used to play Animal Jam all the time as a kid. This channel originally was an Animal Jam channel back when I was like 10, so it just feels nostalgic. Sadly, the normal original Animal Jam Classic doesn't work anymore, and it's sad. It's just so laggy. I hope they fix it one day because I want to play it again. It was cool. I miss the Adventure Base Camp. I remember the days when the Adventure Base Camp first came to the game. I'm that old. It was only like 2013 or something. But yeah. Anyway, hopefully this wasn't too horrible to sit through. If you sat through it, good job. I wish I could give you a cookie or something. I'm probably gonna go get a snack and then waddle my way over to making part 2. Yeah.